When most people hear about gastric sleeve surgery, they picture a straightforward mechanical fix. This animation shows the standard procedure. Surgeons remove about 80% of the stomach, leaving behind a narrow, banana-shaped pouch to enforce portion control. Before the procedure, the human stomach can stretch to hold over a liter of food. Afterward, that capacity drops to roughly 150 milliliters. Even a small plate of food creates an immediate, intense sensation of physical fullness. But treating the gastric sleeve as a simple plumbing modification misses the science of why it works. The physical restriction is only the first step of the procedure. By excising the upper portion of the stomach, a region called the fundus, surgeons physically sever and rewire the communication network between your gut and your brain. Within days, the body begins changing how it produces hormones and supports gut bacteria, altering the internal environment where digestion happens. To understand how this surgery drives long-term weight loss, we have to look past the physical size of the stomach and examine the invisible biochemistry of digestion. Your appetite and your ability to process glucose are regulated by a network of hormones produced directly in your gut. The highlighted upper area of the stomach is the fundus, the primary manufacturing center for ghrelin, the hormone that signals your brain to eat. When surgically removed, ghrelin levels drop. The biological alarm of hunger is silenced. Then comes the second shift. Because the remaining stomach is so narrow, whatever food you eat is forced to empty into your intestines at an accelerated rate. As food reaches the lower gut, it triggers a surge of satiety peptides, specifically GLP-1 and PYY. These are the chemicals that tell your brain you are full. This new hormonal baseline is delicate. Patients sometimes interpret their lack of hunger as permission to skip meals, but doing so disrupts the steady release of these beneficial hormones and risks muscle loss. Patients aren't relying on willpower alone to succeed. Their brain is chemically satisfied, which eliminates the biological urge to overeat. This transformation extends to the microscopic level. Your gastrointestinal tract is home to trillions of bacteria, forming a highly active community. The surgery raises the pH level of the stomach and speeds up transit times. This creates a new set of living conditions for those microbes. Within 2 to 6 months post-surgery, the composition and diversity of your gut microbiota shifts into a new state. Strains of bacteria that struggle in an obese gut begin to multiply. We see a significant rise in beneficial species like Akkermansia and Bacteroides. These new nutsalminate bacteria strengthen the intestinal barrier. In clinical studies, their high population numbers correlate with leaner body profiles and improved insulin sensitivity. These bacteria act as active drivers of metabolic health. They reduce inflammation through chemical signaling, an effect that occurs independently of the physical weight loss. Operating this rewired ecosystem does come with a biological challenge. Because the physical mass of the stomach is reduced, your body produces less gastric acid. A lower acid level elevates the overall pH of your digestion. Combine that with the faster transit speeds, and your food spends less time interacting with critical digestive enzymes. The rapid current and altered chemistry make it difficult for your body to break down and absorb essential elements like iron, calcium, and vitamin B12. The situation with B12 is even more specific. The surgically removed fundus is responsible for producing intrinsic factor, a protein required for B12 absorption. Losing the fundus compromises your body's ability to process B12 naturally, regardless of your diet. The intestines remain intact, but this change in chemistry means targeted, lifelong nutritional supplementation is a physiological requirement. Gastric sleeve surgery is the construction of a new biological ecosystem. To keep this system running, patients must meet specific behavioral requirements. Prioritizing high protein and fiber intake is necessary to keep gut microbial balance thriving. Returning to highly processed foods and simple carbohydrates can quickly disrupt this delicate hormonal and bacterial network, undoing the chemical advantages the surgery created. Managing a metabolic transformation of this scale requires ongoing expert guidance. Monitor shifted appetite hormones, calculate altered nutrient absorption, and track microbiome health, a complex set of variables that demands a specialized medical team. For patients seeking safe, lasting success through this shift in their internal chemistry, Beltre Bariatrics in Florida provides the specialized medical guidance needed to maintain these results.